Hello, this is Dr. DJ LeDrew from Full Potential Chiropractic in Calgary, and this video is going to be about common thing that I've seen over the past 12 years with patients who come in with chronic low back or hip pain. And typically what I'm finding is that there's a functional imbalance in the low back that's contributing to the hip pain. The problem with this is that if we don't correct this in an early stage, it can lead to more low back issues and disc issues and arthritis, but also it can affect the hip alignment, which can predispose you to having hip replacements down the road, and it'll even actually contribute to knee and ankle pain, and that can also contribute to potential risk for knee replacements. And because it's changing the entire alignment of the low back. So what I'm finding is that people with chronic low back pain, as I come up and I assess their hip rotation, we can see that there's an imbalance from side to side. So we can see how this left side rotates much further than the right. And what that means is that the pelvis now is shifted back on that right side and doesn't allow that hip to move. So it's going to cause more grinding inside that hip joint and create some muscle tension in her glute medius, minimus, piriformis, and that's going to predispose her to low back pain. Okay. Now, what the body does is it's going to compensate. So as the pelvis on the right side is rotated back, typically what happens with most patients is that the other side is going to rotate forward. So how we assess that is as I bring these legs up here, I notice that this left side now doesn't come up as far. And that's because the pelvis is shifted forward, not allowing that left leg to come up. Okay, so there's a very specific adjustment that we do to help realign the pelvis to get that into proper function. So let's go ahead and do that. So then we'll just have you on your side facing me here. So what this adjustment is going to look like is we're going to have to take this pelvis on the right that's tilted back and won't move it forward. So I'm going to come in here like this, just relax here, and then we'll go on the other side there. So now I have to bring this pelvis forward here. Just relax there. Good. And then just go face down. Okay, so that adjustment, what that's done now is taking the pelvis from here to here. So as we recheck now, we should see that this rotates properly now, and it does, and these legs come up symmetrically. So now we've got her back into proper alignment. So now we can actually get the benefit of a stretch and an exercise. Because now the pelvis is in alignment, now we can do the stretch and we'll actually have the proper effect. So I'll have you just roll on your back. So the stretch that I like to do is we just have your leg come over here like this, and I'll just have Deb grab here, and she can come down and pull her leg up like that. Okay, now you just hold that for 45 seconds, and then I would have her do that on both sides. So that's going to now lengthen these muscles in the glutes. Okay, so then what we want to do is we want to work on strengthening. So again, now the pelvis is in alignment, we're stretching out the tightened muscles, and then we want to strengthen the weak muscles. So what I'm going to have to do is just pop up into a bridge. So you can just start here, and then you can even just do go down and up. Okay, and you can do 3 sets of 10 of that. To make that harder, we're going to pop straighten one leg out, and then come on up, and then she can come down. Okay, so that's going to help strengthen the glute max. Okay, good, thank you. So there's a great tip on how to get your low back in alignment, but if you're suffering with chronic low back pain or hip pain, this might be what's going on with you. You know, for us, we'd love to take a look and just see if there's something that's going on that we may be able to help you with. If you have any questions or concerns and you're on Facebook, just ask us questions in the comments. If you know anybody that's suffering with low back pain, any family members or colleagues or loved ones, be sure to share this with them, because this might be the secret that's really holding them back and not allowing them to do the things that they really enjoy doing. So again, it's Dr. DJ LeDrew from Full Potential Chiropractic. I hope you enjoyed this tip. Have a great day.